So what I'm gonna do is I just pinch up. This is an incredibly, incredibly safe treatment. So we're gonna go into a little space in here, and it's literally gonna look like a little mound of filler. I don't do it all at once, but I put that in. And what I do is I just start mashing it down in there. It spreads pretty quickly. You're not gonna see discoloration on the hand or anything like that as well. And as we spread it through, and we'll finish a treatment this way. I thoroughly enjoy doing Radiesse for this. Now, the reason it looks a little bit whiter, again, is the anesthetic. So I don't want you all to think that that's the actual filler, but that's just to minimize bleeding and bruising since we're doing this live, and I don't want anybody to feel faint. Least of all our patient, which she doesn't. Again, we're just going to pull up. Actually, and I know I didn't numb you there, but just so anybody can see that it's not that big a deal. If my hair is blocking, you'll need to tell me. And what's really important I want to emphasize is that there is no compromise of hand function whatsoever.
And I can tell you no discomfort right now, and there was no numbing there.
You know, I'm supposed to be credentialing myself here, so just so you know, for the Plastic Surgery Journal, I published on this maybe 2 years ago with videos and our techniques. So I was invited by the editor to publish this. So this has actually been written up and published. So when I say it's in a peer-reviewed journal, I'm one of the peers that published it. So, and I've actually presented this at meetings. So I feel very comfortable doing this.
And I'm proud to say that our offices are recognized as centers of excellence. And that is really impressive.
Yeah. Well, I think that they've done, MERS has done, Michelle Barano's done like a great job of getting people, making sure credentialed and experts. Just because you can, give a shot doesn't mean that you do this, but it's not a hard thing to do. But you can see along the way as we're doing, it's starting to plump up. Again, because this is a collagen builder, it's going to look better as time wears on. Again, I'm just gonna pinch. I will say that sometimes if somebody has very easy bruising, I will use what's called a cannula, which is a blunt tip needle. It's funny because the trials were not done with that. This is just a little white spot. That's not the filler, that was already there. So, and now I'm gonna massage at the end. So let's continue to do your treatment like this. And the syringe, thank you. Thanks, Fred.
Those are some bony looking hands.
Hey, so what I typically do is I like to do 1 syringe per hand, but if somebody's very conservative, or they're concerned, I'll break it up into 2 treatments and I'll do half a syringe per hand. Again, it takes me no difference in time, and if you've taken off work to do things, I can tell you you can go back and do your things, but again, I just don't like heavy weightlifting, anything like that. Can you make a fist for me? All right, can you make this hand as a fist? So can you see that it's already starting to look smoother and you can see the veins less? I haven't even fully massaged it out, but you can see that. And I'm already well aware that I should not be dilly-dallying and taking too much of everybody's time.
Dr. Bucay, how long does this treatment typically last?
Oh, upwards of a year. For sure a year, upwards of that. Now, again, if somebody needs more than 1 syringe, I'll do a syringe first. I have them come back in a month, and then I will do, any touch-up with that. When we're doing IPL, I'll do the IPL first on that same day, and then we'll go ahead and do the treatment, and then they can come back 4 weeks later for their second IPL, and or in a touch-up if needed, as well as, and then a month after that. So I think it's really the nice thing. The other thing that I like about IPL, and people should take advantage of it, if people are thinking, well, I don't have any spots, I don't really need that, IPL is a great way to also stimulate collagen. So we're not only using a filler that stimulates collagen, we're doing treatments that also stimulate collagen. So for that reason, I think it's a great way to do that together. So I didn't inject any veins. What I'm gonna do now is I'm going to actually do the massage part, and I'm gonna use, again, Jennifer with Neocutis has provided the BioGel, and we had some questions like what kind of skincare. This contains this helps the jumpstart collagen production, so it has the PSP in it, the purified protein, and it also has hyaluronic acid to help hydrate the skin. So yes, it's normally a face, face, neck, or anywhere, but instead of using, sometimes I use ultrasound gel for the massage. Today I'm actually going to use the Biogel, and what I do is I just normally do massage, and when we start the other hand, I would have Veronica take over and just massage. So the important thing to do is just massage, spread it out,